We certainly believe her. The World Health Organization says 79 new Ebola cases were confirmed last week. That's the lowest weekly total of 2015. I asked Dr. William Schaffner if this means West Africa has turned a corner. He's chair of the Department of Preventive Medicine at Vanderbilt University.
I think we can be guardedly optimistic. Things are very good in Liberia, where there was only one new case, but things are not where we exactly want them in Sierra Leone or Guinea. And that's because there's still cases. Many of them are in rural areas, and many of them don't come from known chains of transmission. That means we don't know what the sources are. And that makes us suspicious that there are yet other cases out there undetected. But we've made a lot of progress, but this is a marathon, not a sprint.
So what should Guinea and Sierra Leone, what should they be doing?
More of the same. We've got to keep communicating with the local populace so that they don't fear the public health authorities. We've got to encourage them when they have sick people to bring them to the hospital for the care of the sick people, but also to get them out of the home. When they're in the home, caregivers will become sick because of their close contact with the patients. And then we have to make sure that the funeral and burial practices are done with appropriate infection control precautions, because that's where a lot of new infections take place.
And the WHO also says more of these new infections are connected to people who are registered contacts. These are the people who are already known to have come in contact with people infected. So why is it still so difficult to prevent these people from contracting Ebola?
Well, the difficulty is, among other things, that this is a largely rural, not very educated population. They have some suspicions about the central government and public health authorities. We need good local leaders to convince the local population to collaborate with the public health authorities. This is always an intense work in progress.
Well, let's go back to Liberia, which has, it seems that it's turning the corner. Businesses are pleading with the public to go back to their, normal life, but it seems people are very reluctant. How can you assure a very frightened public to just go on with their daily lives?
A step at a time, a step at a time. Every day that goes by without an infection will reassure a few more people. So this is going to take a little bit of time for the society to reestablish itself with some confidence. It's as though you were hit by an earthquake. You can't reestablish the society, all the businesses and the interactions instantaneously. It will take time.
Dr. Schaffner, tell us what the path forward is. What are some of the lessons that we've learned from this Ebola outbreak, and how can we ensure we're not in this situation with yet another disease in a few years from now?
Well, we're relearning old lessons. We have to acknowledge illnesses when they occur. We're going to put in place better diagnostic procedures so that the diagnoses can be made, and then governments and the World Health Organization have to be ready to respond very quickly. There was a great delay here. We have to be able to respond very quickly and send in help, public health help and clinical help, in order to win over the population. And communication, communication, communication. I can't emphasize that enough.
Dr. William Schaffner, thank you so much, sir, for your time.
My pleasure.